Good evening, good afternoon, and good morning to all of you, depending on from where you're joining us. My name is Ananda Galapathy, and I am a co-director of MHPSS.net, and for the next 90 minutes, will be your moderator for this webinar. On behalf of MHPSS.net and Elrha, I'm very pleased to welcome all of you to a very exciting discussion we have for you today on setting priorities for a 10-year research agenda for MHPSS Humanitarian Response. Most of you will be familiar with Elrha, but for those of you who do not know them yet, Elrha is a global charity that works to empower the humanitarian community to improve its response through supporting and championing the outcomes of robust research and proven innovations. And as you will hear soon, the work being presented today was supported by Elrha as just the latest part of their contribution to building an evidence base for the MHPSS field. I should also probably disclose at this point that MHPSS.net played a small role in some of the outreach exercises that will be discussed, and so we're especially pleased to be able to help share the findings. We have a really great panel for you today, and I'm going to introduce them very quickly so that we can get right down to the conversation about setting priorities for research agenda for the field of MHPSS in humanitarian setting. First, we have Carmen Valle, who is an MHPSS advisor working with the IFRC Reference Center for Psychosocial Support, and also as the co-chair of the IASC Reference Group for MHPSS in emergencies. We have also spotlighted today Vitsa Tall, who is a professor of global mental health at the section of global health at the Department of Public Health at the University of Copenhagen. He has several other institutional affiliations to the VU University of Amsterdam and Johns Hopkins Bloomberg School of Public Health. But he's also, here it's important to mention that he's a senior advisor with HealthRight International. P.T. Lay is a research scientist at the New York University School of Global Public Health. And rounding out our panel for this part of the webinar, we have Sarah Harrison, who is the head of the MHPSS Advisors Unit at the IFRC Reference Center for Psychosocial Support in Copenhagen, and she herself was a one-time co-chair of the IASC MHPSS Reference Group. We have later in the webinar an unbilled guest panelist, whom I'll bring on at the very end, Anne Harmer, who's the head of research for health in humanitarian crises, the R2HC program at Elrha. Now, for this first part of this webinar, I will be posing questions to our panelists so that they can walk us through the process, the significance, and the findings of the research priority setting exercise. And then we will open for questions from the floor. And finally, we will also give you access to a platform to access the findings themselves. And so as we go through, as I said earlier, please feel free to pop questions or comments into the chat. We'll be collecting these and putting them to our panel during the Q&A. And if you have any difficulties, just also indicate, and my colleagues, Alok and Valeria will be happy to help you. And so let's get started. Let me first turn to Vitsa, and Vitsa, this is not the first time that you have carried out a research prioritization exercise for the field. Can you tell us a little bit about what you did last time and what the last round of priority setting told us?
Yes, sure. Thanks, Anna. Could my slide go up, please? Yeah, so in 2011, we published the results of an initiative that was very similar in scope and methodology, then called MHSET, or Mental Health and Psychosocial Support in Humanitarian Settings, Research Priority Setting. And what we did looks a lot like a standard Delphi process, which is a form of consensus-based methodology, a way to try and get people to agree on what important priorities are. So multiple structured steps. We followed a specific process out of the Child Health and Nutrition Research Initiative. And what that came down to was that we started out generating research questions. So first we asked a lot of people what do you think, as an open question, are the main research priorities for the MHPSS field? We did that with an expert panel. You can see under step number 1 in the slide, 136 people at that step. But also we wanted to hear voices from people working in the field at remote locations and also in the capitals of these 3 different countries. 114 people participated in those, and altogether those people generated 643 research questions. So lots of research questions. We consolidated those into a list, trying to find the unique ones, trying to combine very similar ones. And then we came back to the expert panel and asked them if they could score the list of consolidated research questions. And we had 74 research questions in that stage. And 82 people were kind enough to participate. And they rated those 74 questions using 5 fixed criteria. And in that way, we could rank all of these 74 questions from the most prioritized number 1 to the lowest prioritized number 74. And we really took a very close look at the first 10 and the first, the top 10. That was what we've been really looking closely at. That's how we worked.
Thanks. And I think you have those top 10 to share with us. Is that correct?
Sure. Yeah, I'm happy to show that. That's on the next slide. It's a lot to look at, so feel free to look at the paper. I'm happy to share a link in the WhatsApp group. But on the left, I've provided some bullets to give a quick overview. That 2011 research priority agenda was really very heavily practice oriented. In other words, it asked very practical questions, things that would probably improve the knowledge that was going to be generated through those research questions would improve practice quite immediately. Questions like, what are the stressors faced by populations in humanitarian settings? What are appropriate methods to assess needs? What are good indicators to use when doing monitoring evaluation? Those types of questions. There was also a strong emphasis on knowing the problem from the inside out, so understanding what the perspectives are, understanding what the problem and the appropriate interventions are from the perspective of people affected by humanitarian crises. There was a heavy emphasis on problem analysis questions, in other words, questions that had to do with understanding what the impact is of humanitarian crises, how people define them, how people experience them, etc. And then there were 2 specific questions around the effectiveness of prevention interventions, with a particular focus on family and school-based prevention interventions. That's, I think, roughly what was prioritized then.
Thanks for giving us that summary. Now, a decade on, you undertook to do this again. What did you expect that an update might be able to offer us 10 years later?
Well, I mean, first of all, we were kind of compelled to do it again because quite practically or pragmatically, we picked a 10-year research agenda for this initiative. And that was done for a reason. We thought, okay, well, these questions, the field moves so quickly that those questions are probably still going to be relevant 8 to 10 years later. Sometimes these initiatives are done with a 5-year research agenda if the field moves really quickly. So there was anyway a kind of 10-year limitation to this research agenda. But I think, yeah, more substantively, I think a lot has happened in the MHPSS research field. The research is really exploding on this topic. And of course, the field itself has changed. The stakeholders have changed. The people working in the field have changed. So we thought it was important to take a fresh look at what the priorities for research may be now. And we wanted to do that from afresh with people who are representative of the field as it is right now. And of course, that could also help us to understand if there have been any shifts. It's not so easy to compare from before until now because we followed slightly different methodology. The gist is still the same, but slightly different. It's not a pre and post test kind of situation, but I do think we can get some insight into how research priorities have shifted in the last decade.
Thanks, Vitsa. I'm going to stop you there because I'd like to keep us sort of on a cliffhanger. We are going to hear from you about the ask you about the new priorities and whether they're different. But before then, I think something that was different this time, the IASC Reference Group on MHPSS got involved in the process in a quite integral way. I'd like to turn to Carmen now and just ask her about what specifically the reference group's interest was and why did it feel it was important to be involved in this kind of exercise?
Thank you so much, Ananda, and so wonderful to be here. I'm just seeing the colleagues that are joining us online, and I'm all excited how many wonderful friends and dear colleagues that have participating very actively as well. And I think maybe that's part of it, is the bigger growing community that has a very important voice to have in these processes. But I think the main point that I would like to start with is picking up from what Vitsa was saying in terms of how much change and how much has transformed in the last 10 years in the field of MHPSS research, but just MHPSS implementation, how many organizations we have these 10 years on that are doing MHPSS work. Just as a number, a figure that we use a lot these days, the number of technical working groups, coordinating mental health and psychosocial support activities at country level has shifted from around 20 groups to almost 60 at this point, when in 60 and almost 60 context, emergency contexts, there are active MHPSS coordination. So the field is expanding, the number of organizations is expanding, the number of academic institutions with research priorities on MHPSS is expanding. And as reference group, I think one of our key priorities, and almost going back to the point of what we exist, is to make sure that as MHPSS evolves, we continue sticking to quality, we continue sticking to evidence-based, and we continue giving advice and guidelines that are helping all implementers at country level do work that is well aligned with, again, evidence-based, quality, and that is connected with what we learn from an academic point of view. So from us, it's almost intrinsic to our nature as reference group to make sure that what is done in country level operations is very well aligned. But the other way around, we really want research to be well fundamented in what the field needs to say, on what country level operations expertise needs to contribute. And in that sense, we felt that we were very well placed as a little bit the organization that is linking country level and global level that could provide that contact with the colleagues that are working in different organizations and in different interagency groups at country level to give the opportunity to input this second round of research priorities. So it's a great opportunity for us to link and to make sure that the country level operations are feeding on research, and that then research can feed on what is being done at country level, and that's a role that we play in other areas that is not only research, and we thought this would be a great contribution to that bridge and making sure that there's voices. I would like to say, though, that probably the most obvious, and maybe is my final point in this regard, the most obvious why is what we are aiming to achieve in general on MHPSS. Mental health and psychosocial support is about the improved well-being and mental health of those affected by emergencies. If we want to do this with the best way possible, if we want to have those affected by emergencies improving their well-being better, we will benefit from research. We will benefit from knowing better what to do and how to do it, to connect this research to our M&E and monitoring and evaluation programs to make sure that what we are doing is of the best quality possible. So I guess the reason, the real reason why, it's because we are at the service of the communities affected by emergencies. If we do this right, and if people take into consideration these priorities, then we will be doing that in a better way. We will be improving well-being of the communities even better and more, I hope. So for us, it was quite a straightforward wishing to participate.
Thank you, Carmen. Thank you for outlining that to us. And I think, yeah, you put it so well. I now, it also puts a lot of pressure on this exercise to deliver, right? And I'd like to turn to PT, who along with Vitsa led this process and implemented it, and invite PT to share with us a bit about the question of how we actually went about this exercise. What was different this time from before? PT, over to you.
Thank you, Nanda. Thank you for bringing up the slides. Great. So I'll go briefly over the methodology of the exercise, the priority setting exercise. Next slide, please. The initiative was, again, to kind of provide the next decade of research prioritization for the field. In terms of governance, it was it was governed by two entities. One is the Funding and Policy Council, which was chaired by Alistair Aguirre and Mark Van Almeren. And then we also had the Scientific and Practice Advisory Board that was chaired by Sarah Harrison and Vista. Now the FPC, the Funding and Policy Council, their charge was to, it composed of a 15-member team, and their charge was to make sure that we have buy-in from funders and policymakers from the beginning, as well as the dissemination of the results. The SPAB, the Scientific and Practice Advisory Board, we had more implementers in this round, I believe, and their charge was to oversee the process, the methodology of the project, as well as providing nominations for people who would be part of the expert panel. There were 25 people on the Scientific and Practice Advisory Board. The FPC was also a new addition for this round of priority setting exercise. And next slide, please. So this is the overall methodology of the study. We had 3 steps, basically. The first step was the research question generation step. Second, we had the team of at HealthRight consolidate the research questions. And then the third step was the final step where only the panel participated. And they were selecting the top 20 questions and then scoring the top 20 questions according to 3 criteria. So I'll go briefly over the first step. So next slide, which comprised of 3 parts: panel, the DIY consultations, and the qualitative study. For the qualitative study, which is very similar to the first exercise, we did have 3 countries again, but it was 3 different countries representing different types of humanitarian crises that are listed there. We had the key informants interviews and focus groups that were conducted by people, by consultants who were in-country team leaders who were conducting these KIIs and FGDs. We asked participants, and these are, some of them are the service users of MHPSS. So they would pre-list the questions that they would prioritize for the research agenda, and then they would also rate the importance of those questions. And then so when the country teams, the in-country teams completed these research questions that were generated by the qualitative study participants, they will send over to us the summary forms for the HealthRight team to consolidate. The second component was the DIY consultations, and which was completely new this time around. And this was in conjunction with MHPSS.net, where we conducted a social media campaign. We did a webinar, we created a toolkit and a summary form. And what we wanted to do is include more voices from the field. So we invited any group of or more individuals, and they could be anywhere, in the world, who are involved in MHPSS activities in the field, to conduct a do-it-yourself discussion focus group, so that they can then propose the priority research questions. Each group could send up to 10 research questions. And so we got the summary forms. It was via the on online form, or it could be an email, a table format that you email us. The third, but also the first component for the first step is the panel. And the panel was by a snowball sampling method, nominations from the Scientific and Practice Advisory Board. We also invited the working group chairs or co-chairs, and then they were asked to basically propose the research questions via an online survey. We did multiple rounds of nominations because we really wanted to try to get as many people as possible. And so I think we ended up, for this first step, we ended up up to 300-ish proposed panel board members. Each time it was about 230 panel members who participated and generated the research questions. So now I'll go over, next slide please, some of the who participated. So in the qualitative study, we had, like you saw before, the 3 countries, Lebanon, Indonesia, and Uganda. So we have the key informed interviews or in-depth interviews. Those are the breakdowns. As you can see, there were, in Indonesia, we had the most number of participants, and they had 57 focus group participants from the 6 focus groups that they conducted. But in total, we had 29 key informant interviews from all 3 sites, and 8 focus group discussions comprised of 68 participants. Next slide. These are some of the statistics for the DIY consultations in terms of the groups who were involved. So you can see the breakdown. Most of them, 30%, NGO. And then we also have the NGO CBO or CBO only, and then Red Cross Red Crescent, of course. We had 27.3% from the working groups. About around 11% identified themselves as research groups. And then we had the intergovernmental or governmental organization comprising about 10% of the makeup of the DIY consultations. Next slide. These are the numbers for the panel participants across the 2 steps that they were involved in. So anyone who any expert panel member who participate in either or both of the steps 1 and 3, we can see there that we had them broken down into the type of stakeholder. So they were either a researcher, implementer, or policymaker. And we further broke them down into whether or not they were working or living in an LMIC or a high-income HIC, high-income country. We can see that the composition and the majority of them were implementation experts, and actually the majority of them also came from LMICs as well. Some of, and that's all for the slides. I just want to highlight a couple of things, that some of the major differences, like I mentioned, that there were definitely more implementers this time around, including in the Scientific and Practice Advisory Board, and also in the makeup of the panel. And then the DIY consultation, getting closer to the field. Yeah, that's all.
Thank you so much for taking us through that quite complex process very simply, PT. I suspect that there are people in the audience who participated in one or multiple rounds of the consultation. So I'd like to invite you for this next session, if you'd like to just share a little bit of your experience in the chat whilst I invite Sarah. So Sarah wore multiple hats during this process, being part of the steering group, but also serving on the scientific and practice advisory body, and then also, of course, participating as a practitioner in her own right. So Sarah, I'd like to ask you a little bit about your experience as a person who played perhaps the roles in those in the scientific and practice advisory board, as well as a practitioner trying to answer these questions that were put to you. What was that like, and what were some of the what are some of your reflections on that process?
Thank you for the question, Ananda. I remember it being a lot of work, which no one tells you this when you enter a research project, by the way. So be warned, practitioners out there. I also was involved in the 2011 one, also with Vizia, and I was in the co-chairing role then. I do remember back in 2011, I think we had 74 questions that we had to rank. And I just remember that being cognitively quite overwhelming, and my brain not being able to function after about question 25, and then it didn't become such a rigorous exercise, or my ability to do it faithfully wasn't as strong. So I think the methodology used this time actually facilitated being the people responding in the surveys. Actually, it became cognitively easier to manage and review and to reflect on the number of questions. I think it was a privilege to be asked to be part of the Scientific and Practice Advisory Board and to co-lead it with Vizia. And it also very much enabled me to kind of open the contact book and say, okay, who is a key player at country level in this area now, whether it's a policymaker, researcher, an implementer who I think should be involved in this formally, and I think a lot of people actually said yes and volunteered their time to be involved, and these are people that had actually not been involved in 2011, even if they'd been working in the field for many years. They'd never had the opportunity or never been asked. So I think that it reinforced very much the country level side of it, whether you're a country level researcher or a country level practitioner. I think we were better able to capture you this time, and it's always, no one tells you, yeah, when you get to see your answer up on the screen, when you get to see your question that you'd put forward in the top 20, it's kind of like a big yes. It's almost gamified it in a way, which makes it quite exciting, and it validates you and it validates your colleague's viewpoint as well, because you can actually see that your viewpoint that was put forward is actually reflected, and it means something, and you're also not alone in thinking that this research question is poignant. It's actually a research question that applies in many different contexts as well. So I think the gamifying, the ranking part of it is a little bit exciting, particularly if your question comes up in the top 20. If it's not, then kind of bad luck. You have to kind of roll the dice again. So I think that made it quite interesting to be part of as well. And I think for the link also with the with researchers and also with the Funding and Policy Council members that I had, that really enabled discussions to happen at country level that were not otherwise happening. And I think particularly in the DIY consultations, and also when they did the more in-depth qualitative studies in some country, there was a concerted effort to make sure that those groups were actually included, or those profiles of people were included. And we don't necessarily talk to them. So it's not necessary that a community-based organization would have a direct link with a policymaker, or even with a large donor, for example, Wellcome Trust or whoever. And those links, it was nice to see them being created through this exercise as well. So I think it was also just a privilege to witness it as well. And it also took longer than I thought it would. Because I remember looking at the methodology and being like, yeah, this is fine. You just sit there, you come up with questions, and then you just rank them. It actually does require time. It requires time for reflection, for you to generate questions, for you to genuinely think, okay, what is an issue coming up within my organization, or that I have a gut intuition is important. and then also going, as I said, going through and ranking them as well. And from being a scientific and practice advisory board member, it was also making available kind of my contact list as well, and that also takes time because it's a lot of going through your emails or whatever contact books you have and thinking, yes, this person is a good person to put forward and they're available and they're willing to put time into it unfunded as well. So yeah, it was more work than I expected, but happy to have been involved for the second time.
Thanks, Sarah. I think the what you outlined in terms of the drive to be as inclusive as possible and especially involve those who are not typically part of these kinds of conversations or hadn't been able to be a part of it the previous time around is really important. But I do recognize that it's a really challenging task to reach those who are not in touch with where things are happening already, who are not in the contact list. I wonder how some of these, you spoke about the fact that it took much longer and was possibly more work than had been anticipated. I would like to turn to PT and ask a little bit about the challenges of actually implementing this methodology. You spoke, and I think you hinted at the fact that you had to do several rounds of initial consultation around to get, the however many kind of STEM proposals that people could later rank. Could you tell us a little bit more about some of those challenges and perhaps how you tried to mitigate or overcome them?
Yeah, I think everybody who was involved, me included, in the beginning, thought that it's like a 6-month project, but it was also implemented during COVID, and we were all very busy at that time, so we had to go through. We had to keep extending the deadline for people to submit their online responses in all of the stages. And we understood that people had a lot to cover, so that was fine. But that was one of a major challenge is that being inclusive, trying to be inclusive, and understanding of people's timelines and projects, etc. So that was a major challenge. The second challenge is I think during the consolidation process, as Sarah has alluded to, that we wanted to be respectful of people's choices, when they were proposing the research questions, and the voices that they were giving us. And this time around, we had a total of 1,500 research questions that were proposed. So that was a massive task, trying to consolidate the questions, group them, the similar ones together, and getting the insight, the core essence of what that research question was. So our team had that task of doing that, and we tried to respect people's wording. So we try to take the words from the way that they pose the questions themselves. And one of the ways that we one of the strategies that we took was obviously grouping the similar questions together, but taking the framework from the prior setting exercise. So we had 4 themes from the last time around. So that was our starting point. And then we added more questions, more themes. So this time it was 6 themes that were generated. So we add 2 additional themes plus a special topics, which included COVID and digital or remote research questions. So that was one. And the other one was also the strategy of in the selection, the third step of the panel selecting the top 20 questions, we opted to go with presenting people options of choosing the superseding question for their top 20. And then we had options for them to also select within that overall general question to select a subgroup. So for example, a superseding question was, what are the mental health, what are the most important mental health MHPSS issues among, in humanitarian settings? And they could select in among adolescents, among people with HIV, or among people who have been in armed conflicts, etc. So those were the options that were provided. There was a question, I think, in the chat. We in the consolidation phase, we chose the questions that were voted or proposed by more than five participants in any of three sources.
Thanks for taking that, the question from the chat as well, PT. And now I think we've kept you on TED Talks long enough. I think it's time to ask Wietse to reveal to us what were the priorities from the field, from researchers and practitioners for the decade to come. And also a question, had they shifted much from 10 years before? And were there any surprises? Wietse, over to you.
Thanks, Ananda. Yeah, could that slide go up, please? Great. Yeah, so this is the top 10 research priorities this time around. Like PT said, we were less focused on a top 10 per se this time around, but a top 20. So in the past, we had 74 questions. We asked people to rank them. So we had a number 1 and a bottom 74. This time, we asked people to first select 20 out of a longer list and then rank those 20. So I think in this case, the result is really a top 20, but that takes quite a bit of time to go through on a webinar. So here are the top 10. I hope that's a bit easier to digest. I've put in boldface the keywords in each question so you can relatively quickly go through, but just going from the top, how can we strengthen the MHPSS workforce? What are appropriate methods to assess outcomes and impact? How can we effectively develop MHPSS M&E in research systems? What's the added value of integrating mainstreaming MHPSS across diverse sectors? How can we better develop supervision models and strategies? What's the effectiveness of remote digital MHPSS delivery? And question number 7 requires a little bit of explanation. That's one of those questions where we had a fold-out menu. Is that what those things are called? When you can click on something or a drop-down menu. I think that's probably the more accepted term, but that can change. This was a question where you could click on a drop-down menu and select if you wanted a particular MHPSS intervention that you were curious about the impact of. Question number 8, how do mental health and psychosocial concerns influence social and economic outcomes? How can we develop and adapt tools that are culturally and cross-culturally valid? And how can we assure the sustainability of MHPSS services in various settings and sectors? So that's the top 10, just a pretty yeah, I think a very interesting list of research questions. Can we go to the next slide, please? I think the answer to your question, Ananda, about whether there were shifts, I think is a definite yes, with a minor no. So I think there have been shifts. You can see that the 4 of the top 5 questions in 2011 don't feature anymore in this top 20. So though the number 1 question in 2011 was, what are the stressors faced by populations affected by humanitarian settings? How can we assess needs? What are local perceptions on MHPSS impacts? How do we adapt MHPSS interventions? Those are no longer in the top 20. So I think that's an indication of there definitely having been a shift. I think the minor no is that in the essence of this research agenda, again, is heavily practice focused. So this is again a practice-oriented research agenda. In other words, it doesn't feature very hardcore fundamental research questions, for example, about how particular MHPSS concerns manifest, are determined, those kinds of questions. Rather, the top 20 is dominated by questions around strengthening the workforce, building M&E systems, and more practical questions like that. There are, again, quite a few intervention-focused research priorities, but my sense is that those intervention research priorities have shifted. So in 2011, the intervention research questions were a bit more about basic questions around, is this or that effective? The impact of MHPSS interventions is still question number 7 in the top 10. But what I think you see more strongly is questions that focus on the systems through which interventions are implemented. So it's, I think, a strong shift towards more implementation research. Who is supposed to implement? How can we strengthen those, the quality of the implementers? How can we do better supervision? What are the outcomes beyond mental health? I think those questions around how can we integrate and mainstream MHPSS across diverse sectors? How can we strengthen sustainability? I think those are all much more broader systems-oriented questions. And finally, I think a big shift is that there is much less problem analysis research. That was a strong emphasis of the research agenda in 2011 and still featured, but much less prominently now.
Thanks, Wietse. I'd just like to ask a question about the, you highlighted the emphasis on practice, and PT was in the slide she shared with us, there was a predominance of practitioners, implementers who were responding. Can you comment on whether, that predominance may have swayed the emphasis of the exercise? Were there differences between what researchers prioritized and practitioners prioritized?
I don't think that was a major. I don't think that that's a major issue. It was not a major issue in 2011 because we saw very strong consensus between participants. More than 90% of people agreed on the highest research priorities. And this time around too, yes, there were more implementers in the sample, but I think they prioritized research quite similarly to the researchers in our panel. There were some differences in emphasis, but I think those were relatively minor differences overall. That was really, they came up with the same research priorities and scored them similarly. But some differences, policymakers scored questions on the digital interventions and resilience, and maybe not surprisingly, comparative cost effectiveness higher, whereas practitioners were really more focused on the integration of MHPSS across different sectors, and researchers emphasized questions around stakeholder participation and sustainability more.
That's very interesting. Thank you, Wietse. Anyone who'd like to ask further questions about the priority list, please do put your questions in the chat, and we'll get to them very, very soon. But what I'd like to do right now is actually turn to the question of how, now that we have these findings, what do we do with them? And I'd like to ask Sarah and Carmen to respond to that, as people both involved in the exercise, but also now with their other hats on. Sarah, as someone who works with a practitioner organization, IFRC, that works across a wide range of settings globally, and then Carmen, who spoke so eloquently about the value for a group like the IASC Reference Group. How, now that you have these specific findings, how do you see them being used? Maybe Sarah first and then Carmen.
Yes, thank you, Ananda. So I can say that from IFRC's perspective, we were included actually in one of the DIY consultations, or rather we took part in one of the DIY consultations, I should say. That's as PT showed on the pie graph, the Red Cross Red Crescent input. So within the Red Cross Red Crescent movement, we have something called a research network that a number of you are actually part of. It's not specific just to the Red Cross Red Crescent, is open to academics and at universities, or also independent researchers. And our DIY consultation was done through that network, actually to generate questions that were important for us that we would like to have seen reflected in the study. So it's great to see some of them there. And I can say that from an outcome perspective, so with the 20 questions that have been prioritized now, a lot of them are actually in line with our policy. We have a mental health and psychosocial support policy that's applicable to all of the 192 national societies. And we also have a resolution, a legal document with member states, the 196 state parties to the Geneva Conventions. And actually our priority statements in those resolutions and our priority areas to work on in our policy, a lot of them are overlapping with the research priority questions. So for example, we have a big focus on capacity building of volunteers and staff involved in the movement, but also public authorities in our auxiliary role. And that is very well reflected in the statement looking at workforce development, for example, that Vitse showed in the priority rank questions. Also issues to do with sustainability are also particularly important for us as well. So as I said when I spoke earlier, it's nice to see things that are important to your organization being validated and are also important for other organizations. They're also struggling with the same issues, if I can say that. And I think it really helped to get that collective kind of advocacy around research funding, but also around organizations coming together to have conversations about, okay, how do we collectively tackle this? How do we collectively do systems building for whatever that is in an emergency context? Or how do we measure things that are beyond a mental health outcome to look a little bit more at social determinants that a lot of longer term, more development oriented organizations are working with, or post-conflict, post-disaster type reconstruction. And so it's good to see that. I think it very much helps us. It validates our policy statements, and it also helps give a little bit of a strategy also for the research network within our Red Cross Red Crescent movement as well, to say, okay, as a research network, can we see if we can put in calls to funders to begin doing research? And I think where we do already have money for example, an emergency response, or for a particular lessons learned type activity, it helps us to then be able to pick some of those research questions and say, actually, why don't we start with these research questions and see if we can actually do it more in real time whilst the emergency is going on, if we already have funding in place, for example. And that's something that we're looking to do, particularly with our response to Ukrainian refugees, but also our work in other parts of the world as well. So it's not a cheat sheet, but it actually helps us with the hypothesis, the questions that we want to come up with to test, and to know that it's got this collective backing from a lot of organizations and a lot of researchers and policymakers as well. And I think, frankly speaking, it also helps in discussions with donors. So the piece on supervision that's come up as one of the key questions, I think number 5, it was ranked. We have already been doing a piece of work on supervision models and approaches and researching how best to do this. And we have already funding from a donor for this, but I think it very much helps the donor to know that they're supporting something that is also of importance to a broader field and not just to our organization. And it is a priority question or area of work, because there's lots of competing priorities out there. There's lots of things that need to be funded, lots of things that need to be researched. So this just narrows it down for us and makes it a bit simpler as well.
Thanks, Sarah. Carmen, over to you.
Thank you so much. I was taking notes from the chat, from Sarah, from all of you. So I don't know how am I going to understand, find myself in my notes, but I will do my best. I think the point on the donor that Sarah was mentioning is a very important one for us. Not so much from the agency point, but the opportunity that we have as the reference group is to bring this interagency call for action, if you like. So I think one of the biggest outcomes or utilities of this product for us is actually advocacy at very different levels. So I think from the process itself, knowing that the process has been, as has been described in this webinar, the process has been so consultative, so listening to the ground, listening to the country level, listening to organizations, is very practitioner based, as we've been hearing. So that's a very good tool for us to then do our advocacy around these key areas that require further research. And when we support as the reference group advocacy, then we can bring these perspectives, and we can say not because we say so, it's because all of this we have the, I think there's almost two outcomes. You have the research priorities as an outcome, you have the process as an outcome. It's a very important advocacy tool for us to say this is how it was done, this is what all of these professionals, practitioners, academics, and so on think is a priority. So I think that for us is a very important part of the process that we can use moving forward. Actually, this is so important for us that what we hope will be another outcome of this process is to have an interagency policy brief based on these results that we're hoping the reference group will be able to put together with the colleagues in this project. So actually, there is a very strong positioning from the interagency to say, this is a priority not for this research project, this is a priority for the sector. And hopefully that will bring our colleagues in different organizations and academic institutions to contribute to these research questions. And this brings me a little bit to our the group of organizations that are members of the reference group. We have, of course, many MHPSS organizations and implementers, but we also have academic institutions as observers of the reference group. And for us, it's very important to also, when we provide a lot of guidance to MHPSS implementation organizations on how to do things, what could best practices, we can now have another way of guiding academic institutions. And when they look at us to see what is it to be done, what to put the focus, what to put the resources, we can definitely have this tool to guide that process. And hopefully, also as Alistair was saying, start also taking what has been done and be able to track what of these pieces of prioritization are being covered, and then how can we give visibility to those outcomes. We can also build the outcomes of this research into the products that we create as the Interagency Standing Committee. So we will continue to create guidelines and tools related to different areas. And we can listen to these priorities, and we can listen to the outcomes of any research that comes out of prioritizing any of these areas. So we can build the results into the products that need to continue being made. And one part, I was kind of saying that maybe I will be able to answer a little bit of what Alison was saying on the chat about implementation research and how to make it a reality. I'm not sure I have an answer, and I'm not sure if this final comment is more or less doable, but I have a feeling that this is also very important to connect with the localization agenda. So when we go to country level implementation, when we support country level implementations, can we tap more and more into local or national academic institutions? And can this prioritization be a way to link with academia in each of the countries where we work? For our MHPSS colleagues at country level, to have a good tool for dialogue and for looking together at things. And I think that can be a way around the difficulties on implementation research, a way of building, strengthening the capacity of research at country level. Very well linked to the implementations on MHPSS that are happening in that same context. So very contextualized, very here and now, the organizations implementing and the research institutions in those same countries. So this is maybe a little bit more of a loop, but I think it can contribute when we have a shared language, knowing that these are the priorities we all agree are essential to be looking into. This is my chaos of notes. I don't know if I'm missing anything, but yeah, those are the things that I can think about right now.
I don't know if you're missing anything, but that's a lot. And I think I'm struck both from what Sarah and what you're saying, Carmen, that the myriad ways in which this this set of findings can be utilized and kind of how it dovetails with other initiatives and needs that exist and processes that are ongoing. So thank you so much for sharing that. I'd like to sort of try and get another take on the utility of these findings and ask Vitsa to put his sort of researcher hat on and say, as a researcher looking at these findings, how would you think about using them, and how would you see colleagues in the research community doing so? And yeah, I'll just stop there.
Yeah, I think there's things we should do on the short term as researchers and things we could do on the midterm. On the short term, I think it would be really good for researchers to reflect on whether the research they're currently engaged in is in line with these research priorities, or whether there are maybe more academically driven topics that are heavily discussed in the peer-reviewed literature, but that don't feature at all in this top 20, for example. And then to say, well, is it because I'm working on a very small topic where I know very well what the major research gaps are, or are there these more academic ivory tower types of considerations feeding into my research focus? I think in the short term, that kind of critical reflection would be very helpful. On the midterm, looking ahead a little bit longer, I think it's good to look at the general gist of the research agenda and again critically reflect on whether the research partnerships that you have, the broader research infrastructure that you are a part of, is aligned with this research agenda. So in terms of partnerships, but maybe also in terms of the things that you teach to master students, the bachelor students, the PhD fellows, etc. Education, the tools that you yourself have as a researcher. Now that we see this shift from effectiveness research, you could say, to more implementation research and still a very practice-oriented research agenda. Are those skills in my toolbox? Is that what I learned during my master's or PhD, or do I need to learn some new skills to be able to execute this consensus-based research agenda? Of course, there are limits. I think most researchers feel those quite strongly. There are limits to the choices you have in terms of what you can focus on as a researcher. You often are dependent on external funding from research donors. So I think on the mid and longer term, maybe it's also our responsibility to hold this list up to our donors and say, hey, this is the stuff that as a field we have consensus on, we need to know more about, but your calls for proposals tend to focus on other things. How about that? I think that's an important conversation that we can start as well.
Thanks, Vitsa. And that's a great point at which to bring in Anne Harmer, who is the head of research for the Health and Humanitarian Crises program at Elrha, which supported, of course, this priority setting exercise, and is our final late joining panelist. So you've been here the whole time, and thank you. I'd like to, what Vitsa is raising about donor priorities and especially those who support research. How do you see the findings being used, and how might you as Elrha be looking to communicate with others funding MHPSS research to respond to the priorities from the field?
Thanks, Ananda, and hi everyone. Great conversation so far. As I see it, these 20 prioritized research questions are actually a resource for all funders and potential funders of MHPSS research. And in response to a question that was asked by George Alafagundika, is it just for the MHPSS.net community? No, it's not. These are questions that have been identified across the community, and it's great that whoever can access the resources to fund it, collaborates and participates in this. In terms of what we have now is we have a resource that will provide guidance to funders in terms of the really important questions that really need to be answered if we want to provide the best possible MHPSS support in humanitarian settings. So this is really good. This is really exciting. And you will recall, Anandra, that at the beginning, PT talked about the Funding Policy Committee that was established as part of the governance for this piece of work. So right from the outset, there was this foresight that we need to know that people are on board who can actually be aware of the work and know about what's happening, what's taking place, and access to the results, so that it can help to inform their priorities in terms of future funding. So we're really hoping that both existing and new donors will be inspired to fund more research to increase the evidence base on MHPSS response. And speaking specifically through Elrha about Elrha's R2HC program, I mean, so far we've funded more than 24 MHPSS studies since 2015. This is testing and looking at the effectiveness of different MHPSS interventions. What's exciting about the newly identified 20 research questions and also their sub-questions is that we can now be sure that future studies that we fund are aligned with the priorities identified across the MHPSS community. This is really important because we don't want to fund random research questions that are interesting but aren't of use to those who are operating in the field. And it's particularly important to us to make sure that the evidence gaps identified by practitioners are the ones that are addressed, because it's sometimes easy for research topics, particularly historically in this field, to be driven by the interests of researchers, not those who actually use the findings. And this also kind of, a further reflection is Carmen's point about partnerships, research partnerships, and what we do in the R2HC is increasingly to look at how we can collaborate with researchers in LMIC settings to make sure that the research that they fund is actually corresponding to local needs, interests, and is kind of culturally influenced and informed. But back to the point around the Funding and Policy Committee, we anticipate working in collaboration with others around the table to be able to talk to some of those people, some of whom I hope and anticipate might be listening in on this webinar, to determine how we can collectively get more resources available actually for funding MHPSS research.
Thank you, and that was very encouraging, and as you say, it showed great foresight in setting this up, that you had that committee set up from the very outset. I think we've got loads of really interesting possibilities, and I think possibly also questions about the findings themselves, and we'd like to open up for a Q&A for the remaining 22 minutes of our time. But I'd like to just, before we go, and I think I'd like to invite you to share a little bit with everyone about where they can find. I saw someone in the comments asking, Philip, I think, wanting to know whether they could hear about the other 10 of the top 20 priorities. That's exactly what you're going to tell us about right now, isn't it?
Yeah, thank you. Valeria, if you would be able to show the slide. So Carmen already mentioned that there's a piece of work underway with the reference group that's looking at developing an IASC guidance note. So that's kind of quite a big important piece of work that's underway currently. And there's also a peer-reviewed article that Vitse and others have been working on. But over and above that, the actual findings of the research, we've actually sort of put these into what we're calling a data visualization tool. And this is going to be, we're going to share the link with this at the end of this meeting. But through this tool, you'll be able to see what the 20 questions are, and you'll be able to, using it, it's possible to actually do some filtering so that you can see how the different participants in the study voted, because the results can be filtered by professional status, gender, and region. And you can also filter each question to see the results in terms of how participants saw the significance of the questions, how easy it might be to actually conduct research in humanitarian settings to address the questions, and then also how practical or easy it is to actually apply the findings. So that's the prioritization tool, which will be available from the end of this call, that will show those full 20 questions. And then moving quickly to the next slide, if we may. We've also prepared a report, and this provides more of an overview of what PT and VITSE have presented in terms of the rigorous research methodology that was used to actually come up with these 20 questions. And that's for people who are really interested in the methodology and so on, and will complement actually the academic paper that's currently being finalized. So that will also be available on both the Elrha website and the MHPSS.net website from the end of this meeting. So that's where more information can be found. So I'll stop there, Ananda, to let everybody else have a chance to ask questions. Thank you.
Thank you, Anne. And yes, we will be sharing the link to the respective pages at the end of the webinar. But before then, I know that there have been many questions that have come in through the chat. I'd like to invite those of you who have not had a chance to do so yet to add your questions in. We have about just under 20 minutes for this. And I'm going to be, my colleagues have been helping to compile some of the questions from the chat, and I'm going to try and pick a few. I apologize if we aren't able to cover all of them. If they are really compelling ones, we'll try and get them responded to in another way, and maybe put the responses up on the same page on MHPSS.net. But I'd like to maybe pick up from a point that Alistair Ager, who was one of the co-chairs of the funding and policy committee raised, which was about highlighting the importance of the implementation questions, but also recognizing that these are potentially very challenging to address, and we need to find ways of doing this sort of research more readily. And I think Alison Schaefer also mentioned, she said something about, I think that these are really interesting, but she finds it challenging to know exactly how to go about this, and look to the panel for some suggestions around, and perhaps others on the call as well, about where they might get started to learn about methodologies and kind of approaches for doing this kind of work. So perhaps over to the panel, but maybe I'll put VITSE on the spot first. Anyone else would like to chime in, please do.
Yeah, I think this is really a good question. What I read in Alistair's comment was also, how can we make sure that we build on existing research findings? We've already done so much, right? There's already quite a lot of knowledge on.
I was going to ask that question next, but yes.
Okay, good.
I see you trying to get to the one you want to answer, but push you for the first one.
Sure. Yeah, I think the implementation research field would be a good first place to start. In intervention research, I think there's often this thought of a pipeline, where you start with intervention development and then move to early piloting and testing, then to small-scale effectiveness study to do a test for a more rigorous, larger evaluation study. And once you have some indication of the effectiveness of an intervention, and that's not, of course, not just through randomized trials, that's through a whole mixed methods and hopefully participatory process. But once you have an indication of effectiveness, you can start actually bringing an intervention out of a more rigorous study into a routine practice setting. I think that's what the field of implementation research really is concerned with. And yeah, that field has really been strongly developing in the last years, also in the field of global mental health. And I think for many MHPSS researchers, that's kind of how they are naturally transitioning from questions about what is effective to, okay, well, maybe this is probably effective, and how do I actually get that to the people who need it? And that's a whole different ballgame. But we are not alone in addressing those kinds of questions across global health and also research in public health more broadly. There is a field with methods and more consensus on how that is to be done. That would be the first place I would suggest to look.
Thanks, Vitsa. PT, how about, would you like to add anything to what Vitsa has said?
Not on the implementation question.
Okay, but then maybe I'll put the second one to you, which is, there was a question raised by Alistair, and I know that this has been a part of the discussions around the findings of whether some of the questions remain on the list, even though they have, in a sense, been answered by research. But it's just that practitioners and policymakers may not know it. Was this the case, and how do we address that? Is there a cheap way of answering these questions, because basically they already have been answered? PT, perhaps Vitsa. Actually, I'll open it to the whole panel, but PT first, maybe.
Thanks. So I think we definitely, so I'm not, in the area of MHPSS in humanitarian settings. But that conversation definitely came up during our discussions with the Funding Policy Council, as well as the Scientific Practice Advisory Board. So there were some discussions on where we should go, like, this group should go in terms of maybe producing some products that will help answer or bridge some of those gaps in terms of the knowledge that's been generated in the field of research to the policymakers and the practitioners. But I will hand it over to the other panel to answer this.
Feel free to jump in. I'll take one more comment on this one.
Can I jump in?
Yes.
Can I jump in, Ananda?
Please do, please do.
I think it's a really important concern to raise. And as PT said, there was some eyebrows were raised amongst some of us thinking, well, this features very highly in the research priority agenda, but don't we already have a lot of information on this topic? I believe some people in the SPAB also raised this. And I think we need to acknowledge that. I think, to me, it is an indication of a barrier for research to flow into practice. Right, so I think this research agenda can be helpful with getting more practice into research, but we also still have a problem of getting research into practice. And to assist with that, I think it's good that we have more equitable partnerships, humanitarian NGOs maybe also build their capacity to do their own research, and that we better understand how humanitarian agencies can absorb research. Sorry. I think the way that we currently disseminate research findings is not really geared very well to the needs of humanitarian practitioners, not in terms of where we do that, not in terms of the format through which we do that. So I think maybe a first step of just understanding how humanitarian practitioners currently use evidence would be a really good first step, because then we can tailor our research products more to the needs on the ground. I think there's a lot to be won there.
If I could add, Ananda, this is something that Elrha through the R2HC is also striving to better understand. And we funded a study that actually looked at what research was out there and the extent to which practitioners felt they had access to it. And very much echoing what Vitsa said, is that they don't see research. If it's just published in peer-reviewed journals, they don't have the time or necessarily the ability to read very detailed academic articles. So we really encourage the researchers who we fund to actually develop products that are accessible that are targeted actually for different audiences, particularly, you know, practitioners who will be using the findings. But there's such a long way to go with this. I mean, it requires a really big effort and a commitment, I think, also of funders of humanitarian response to make sure that when there is new evidence out there, they fund the practitioners who are using the new evidence, not using the same old tried and tested responses or interventions that maybe are not working as well as some of the newer, recently investigated ones. Over.
Thank you. Thank you. And Anne, if I might, just before Carmen's got a hand up as well, but just a question about the bit of work that you did looking into how people use evidence, or whether, was there anything about the kind of forms in which research findings or consolidated knowledge was most accessible to practitioners that you learned from that?
Really, it needs to be simply and clearly described with implications for what the practice changes or the practice interventions need to be, but in a simple sort of step-by-step guide, not full of the background to how, say, how it was found or anything. Just these are the findings and this is what you need to do. So really about simplifying it and making it easily readable, easily accessible. And that's also, you know, it also speaks to the need for us to reach out to those audiences better. I think as the research teams and through the R2HC, there always has to be a practitioner organization involved in the study, but we need to go beyond that to all of those who aren't involved in specific studies and really reach out to them to make sure that everyone is aware, and take opportunities like forums and the reference group to really make sure that people understand what this new evidence is, and to use people to use their own networks and channels really for disseminating this information.
Thanks very much. And Carmen, did you want to comment on this?
Yeah, and maybe I'm echoing what Anne is saying. I think we've all noticed this issue of research dissemination and how, for example, very specifically from the reference group, we communicate through just normal newsletters. In those newsletters for several years now, we've had a little section of research and tools and so on. We can see which resources are downloaded or accessed more, and systematically the ones that are research papers with the old structure of the internet, they are not accessed that much, because who at country level operations has time to read a research paper? It's not possible. So I think several organizations, including the movement, as Sarah was saying, with the research priorities, are looking into this. How can we break this information? How can we make infographics out of a research paper? And I think our role as reference group, just thinking out loud right here and giving myself more work, but I think we need to process as well as reference group how to support this. How can we partner with also with communications colleagues to break down these informations into easy access, quickly to read information. The second point would be also touching on what Anne was saying, to then share this not only with our colleagues at country level, but with the donors as well. Because if we want them to find right, if we want them to also know that this is also an evidence now, that this is now being sorted, that how can they make a more informed decision on what do they fund? And also if they're very interested in funding one project, but they notice, but actually this piece of research is already, like they can have a very strong, important role in supporting our organizations that submit proposals to make them stronger and already based on what is known and accessible. And a final point that I was maybe also related a little bit to the previous question, and it's something that is, I don't have a clear definition on how, but I really think we do have a stronger monitoring and evaluation teams and organizations. Can we bring this to, can we make research and monitoring and evaluation much more connected, much more talking to each other from the beginning of an inception of a project, looking into, okay, how is this going to be then researched by, not necessarily by this organization, which might not have the capacity, but can our M&E already gather the necessary information to become later on a stronger research outcome, for example. yeah, so just to make those 2 points.
Thank you. We are really very close to running out of time, but I'd like to just pose one question, just because it's come up several times in the chat. There were several questions raised about the role of children, perhaps as actors in responding to as service users and persons affected. Sorry. And the second was that there were also questions around age-specific or demographic-specific requests for kind of gaps in evidence or availability of evidence, and a larger point was made. I think it was Usman Hamdani who raised the question of whether knowing what works for whom might be an important part of kind of strengthening the sort of the research into practice kind of agenda. Just perhaps if one or two people would like to respond to something about the role of children and the specificity of what we're finding in relation to specific populations, including many people are concerned and work with different age groups and also different demographic groups, and the relevance of that kind of information for the research agenda.
Yeah, I think PT already responded in the chat to the question. Maybe PT, do you want to say that again about the subpopulations in the drop-down menu?
Yeah, I believe the question was referring to whether or not a highlight was consistently seen across the age groups. So as I answered, this is not results from in-depth analysis, but if there were specific groups that were mentioned in the research question, they tended to focus on like school-age children or adolescents. So those were the two groups that really stood out in terms of the age focus for the research questions that were proposed.
And then if I can respond to the question around particular subgroups needing particular interventions, I think, of course, there's going to be different research priorities for different population groups. But in this exercise, we tried to achieve some kind of balance between making sure that the people who need to be represented are represented, and for them to do that in a feasible way, and still getting to some level of depth. And that's really hard. So some adaptations we made this time around is that we went with 20 research questions to score instead of 74, and that we used 5 research criteria instead of 3. And I think that has helped with the participation. We have bigger representation, I think more diverse representation as well. But it also means that in a way you stay at a relatively generic level, right? So this research agenda tells you where the field as a whole may be roughly at. And that's an important message. But it doesn't tell you exactly, okay, for early childhood, what are the key MHPSS research priorities? I think you get the drift of that through this research agenda, but there may be, of course, some specific shift in interests when you look at particular regions or crises types or affected groups.
Thanks. I'll let Sarah add to that briefly, and then we will have to close, and we will be sharing the links to the platform for the findings in the chat. But do also take the exit survey if you have to leave right now. It's very, very short. But Sarah, you can have the last word.
Thank you. It's just to add on what PT and Vitsi said with regards to the drop-down menu. So children, it was school-age children and adolescents, and that's systematically across the board. We see that children aged 0 to 6 are less included, both in research but also in terms of practice. They're a harder to reach group of infants. to call them that, and we know that. So it's actually just a reflection of reality. And the second group, I would say, going down to specifics, are older adults. They are consistently underrepresented, both in terms of organizations supporting that age group or that population group, but also in terms of tools or methodologies to reach them, because if you look at digital MHPSS, for example, they're not digitally connected in a lot of countries where there are emergencies. They are, again, a harder to reach population in the same way that infants are. So I think the research questions, again, are just a reflection on reality. It's annoying. We know we also don't have very good M&E tools to reach either those age groups either. It's an area that's identified in the monitoring evaluation framework from the reference group as areas where we need to invest more in terms of data collection and ability to have methodologies to reach those people as well. But that is very granular, and it doesn't dissuade the importance of what's come out in the research question. It's just a reflection of reality.
Thank you, Sarah. We have come to the end of our time together. I'd like to really thank the panel for giving us these great insights into the process and the findings and some of the nuances and limits of where this takes us, but it's still extremely exciting. I can see many conversations and initiatives flowing from this piece of work or being informed by it. We as MHPSS.net would certainly be looking to find ways of trying to bring these conversations to you and support them as we may. But it just remains for me to thank all of you who have stayed with us for the last 90 minutes. I think we will let you go now, but stay tuned, because we will try and find ways of following up on this in collaboration with the members of the panel and the institutions that they represent, but also yourselves as stakeholders in the field. Thank you very much, and have a great rest of the day or good night from me and from all of us. Thank you.